Uganda is currently home to the largest number of refugees in Africa, with the West Nile region hosting one of the largest refugee populations. Every day, approximately 150 people arrive seeking safety, which puts a strain on available resources and makes it difficult for people, especially women and girls, to access the healthcare services they need, including sexual and reproductive health services. However, the life-saving project funded by the German Federal Foreign Office and implemented by CARE in partnership with CEFORD is bringing hope to refugees, healthcare workers, and the community they serve. The project provides vital sexual and reproductive health services, reducing the immense workload of health workers, enabling them to focus more on providing quality care and services. Mercy Munguchi, a midwife at Rhino Camp Health Center 4 in Madi Okollo district, highlights the role of midwives in supporting vulnerable mothers access essential services.
When I first came to Rhino Camp, many mothers delivered from home, and few mothers would come for antenatal services, and you would find children who were supposed to come for immunization coming either not in the time of appointment, or some of them totally disappear and they would not come. With the records that are on ground and with visible outcomes that I've noticed, deliveries have increased. In the previous financial year, we had 75% of the population deliver in the hospital. However, in the last financial year, this percentage has increased to 113, which has been a very great improvement in maternal child health care. Concerning antenatal, which is one of the maternal child health services, there has also been a great increase, especially with uptake of these services. Mothers have improved in the number of visits, and this has also given us opportunity for us to health educate them more, to give them prophylaxis more regularly, and to encourage them to keep healthy, to have healthy babies. And our immunization coverage has increased with the help of outreaches, which have been supported by so many organizations, especially CARE. Also the incentives that have been given to mothers, like Mama Kits and Dignity Kits, which have aided our work and which have made our service delivery better in this community.
Our capacity as a facility staff has been built, and we are able to also conduct CMEs, continuous medical educations. We train our colleagues and the other staff, especially the lower cadre staff, the midwife, the nurses, on how to manage some of the cases that can easily cause a mother to die, like postpartum hemorrhage, eclampsia. This is pressure which comes with the pregnancy. Despite the support from CARE in terms of the human resource capacity building, we are still inadequate. We now have three doctors serving a population of 289,000. That's a very huge population.
With the provision of the theater monitors, our monitoring system has improved in the theater, monitoring of the mother's vitals. And then another thing which we also got, which was very fundamental in the commodities, was delivery sets, evacuation sets. We are really pleased along that line. Another critical thing CARE has really helped us much is looking at the area of girl child. They were able to provide commodities like friendly activity, commodities, football, the introducing music and the drama, engaging the social interaction with these children. Amidst all that, we also have challenges. In the theater, our basic challenge is the anesthetic machine.
The Life-Saving Project also focuses on providing prevention and response services for gender-based violence. It aims to create safe and supportive environments for survivors to seek help and rebuild their lives with dignity and resilience. Since its launch in September 2022, the project has positively impacted over 57,000 participants, with approximately 67% being women and girls. Edna Tumalu underwent a significant transformation due to the project's focus on improving systems.
Now we have very many projects that are running Here in this space, women are strengthened in different skills. IGAs that we have are more than 3 here. Women run businesses on soap making. Women run businesses on bedsheet designing and knitting, tailoring. The side of nutrition, women, we have been training them on how they can boost the nutrition of their children to fight malnutrition and even cut the cost on medical bills by also making women trained on how they can preserve foods. Women always depend on the food of UNHCR as refugees, which is only beans and the cooking oil and the maize flour. But because of this support that we have gotten from this project, we are able to produce vegetables.
CEFORD Health Center has partnership with the care supports us with ambulance. It helps us in referrals. These referrals have made the reduction in maternal and perinatal deaths. We also have support from care through leadership and governance. They are able to train our HUMIC through trainings, and this has strengthened linkage between the facility and the community. We also receive commodities and equipments. These commodities are delivery bed, delivery set, the BP machine, dignity kits. Basically, the midwives were trained on management of PPH, BMOC, family planning, young adolescent reproductive health, sexual gender-based violence trainings. We were involved in the community scorecard. The community scorecard gave a way through in the formation of the adolescent youth-friendly space, which has never been in CEFORD.
We used to have high rate of school dropouts, early marriages, or early pregnancy. But now, due to the learning and education project at the health center, it has really reduced the rate of early marriage and early pregnancy. I've gained how to be friendly with the other people. I've known my health, sexual reproductive health. I've known how to control my adolescence age. We have come together as a youth. It has brought us together through the playing tools like the footballs, the ludos, whereby if we come together, we play together. That one promotes unity among ourselves.
The increased access to sexual reproductive health and protection project is a multi-country project which is being implemented in 3 countries, that is Uganda, DRC, and then South Sudan. The aim of this project is basically to increase access to these services, that is sexual reproductive health and then protection services for majorly GBV survivors. The project has also supported adolescent sexual reproductive health interventions across the 15 health facilities, and in particular, we have constructed a youth-friendly space in Omugo Health Center 4, and is providing services. And so far, what we have realized for the past 1 year, we have seen increase in access to these services by adolescents, where previously we had only 77 adolescents coming monthly, but at least now we have seen an increase to at least 340 monthly, according to the report that we collect. Before the project, there was a lot of cases of GBV where quarterly they used to at least report over 48 to 50 GBV cases, but now from the last quarter, we have seen only 18 cases reported. What has stand also out clearly is the case conferencing, which is an innovation where we bring all the key players in case management to come and discuss some of these cases and also set actions on how to improve on case management. And of course, this has helped to improve on managing these cases. This project also, by design, it has one of the key activity that is across the 3 countries. That is the cross-country learning activity, where the different countries goes and visits the countries and see the activities there. And of course, this is basically aimed at building capacity of the different countries, sharing learnings, sharing some of the models that can be scaled up, and of course building network and also partnership building.
The capacity buildings that were done, the different ones to the CEFORD staff, we have learned new methodologies that CEFORD had not been implementing, especially the social analysis and action. We look at the girl sign methodology, we look at the peer educators methodology, and the community scorecard. These are different things that we were not doing as CEFORD before. But because of the localization agenda and also the bringing in of this GFFO project, we have learned a lot, and the staff's capacity has been built. Per the moment, we can go out and implement the sexual reproductive health rights projects very, very okay without any problems.